Hey everybody, Tim Fraticelli here from PT Progress. I'm with Cameron Jadali, and we are going to talk about residencies, what you should know about physical therapy residency programs, because Cam is an expert. We went to school together, WashU, and then you went on to complete a residency. Tell us a little bit about that, some of the pros and the cons of doing a residency, and what you experienced with that.
Sure, Tim. I'm happy to be here. Would love for future residency applicants to benefit from my successes and my failures. So here to tell you all about that.
Yeah.
Right after my DPT program at Washington University in St. Louis, I went to Atlanta to Emory University to complete a neurologic residency training program. And this is something that I feel like was extremely instrumental in my career. Went on to obtain a faculty position at WashU, and then now am beginning my own outpatient neuro clinic here in Chicago. So I think it was very instrumental for my personal, professional, and didactic growth as both a clinician and a person in the physical therapy and healthcare world.
So let me get this straight. So you finished the PT program, went on to neuro residency, came back to the school that you graduated from, started teaching, started taking on the neuro program, developed that, and now you're in Chicago leading your own program. All that came through this neuro residency.
And people always ask, what's the biggest pro? Like, what's the biggest advantage of completing a residency program? And I would say for me, it really jump-started my career by 15 years. I look at myself and people that you and I went to school with, and they were all really smart people, really hardworking and driven people. And the mentorship and the specialty training and the plethora of experiences that I got at my time in my residency training program, I think really kickstarted my career from a clinical and professional standpoint, honestly, 10 or 15 years. When I, went to apply for my dream job at WashU on faculty there and kind of revamping their faculty neuro practice and their vestibular curriculum, I had a wealth of experience and knowledge that, in 13 or 14 months of my training program I had acquired that made me a very desirable applicant. So I think one of the biggest pros is giving you all the tools you need to kickstart your career, whether that's in patient care or management or teaching or research.
That's amazing, because I think also what we've talked about too is just the confidence level that you've gained through that. And maybe that's another pro of completing a residency, how you got out, and can you talk on that and how confident you felt, and maybe how your patients felt?
Sure. I can really speak to confidence on two fronts. One from a clinical side of things, and two from a professional side. From a clinical standpoint, I graduated my DPT program, and really, if I were to get a complex or even a basic neuro patient, would have been pretty nervous. There's a lot of baptism by fire and a lot of healthy, constructive criticism and mentoring. But through my process, I dealt with some of the most complex patients on earth. And the way that my residency program was structured, I got mentorship in pretty much every area of neuro PT. So by the end of my time there, you could bring forth the most complex neuro patient on earth. I think that really inspired confidence in my patients too, knowing that I was so excited to work with a difficult case, whereas in some therapists would shrink and be like, oh my God, I can't be with this patient because they've got 1,000 comorbidities. This is someone that I feel totally comfortable treating. So from a clinical standpoint, it really broadened my horizon of patients I could see, and also improved my confidence. And even when I walked into an examination room, a lot of my patients have told me that I feels like I know what I'm talking about. And I think that really holds true. And secondly, from a professional standpoint, working with the director of my residency program and different faculty members at Emory, in addition to my co-residents who are all very driven and successful people, I learned how to communicate both with my peers in the PT world and interprofessionally with a lot of doctors who dealt with vestibular neurology or movement disorders, or communicating with doctors and OTs and speech therapists and nurses. I think professionally it advanced my career, one in the sense of the interprofessional, but then in the intraprofessional, through the residency training program, and the didactic portion led me to meet people like Dr. Terry Ellis, who's out of Boston, Dr. Beth Fisher out of USC, and network with all these great minds. So I got comfortable talking to the big shots in the field, so that when I went to sit for interview with my current job, I felt supremely confident with these
Mhm.
people who are, much more accomplished than I am.
Another thing that I'm really curious about, because you don't have to complete a residency to sit for the board exam, but you did, and talk about how that might have affected your ability to ace the exam, because I know you probably approached that with the same confidence, and how that affected your test taking.
Yeah, the really nice thing is through my residency program allowed me to meet some people that I set up an online review group with. So we would meet in a Google chat, much like you and I are right now
Sure.
conferencing. And each week we would draw from each other's strengths and provide detailed review guides. So for me, it provided me with a very structured group of very talented people to check my knowledge with and quiz with. So that was really helpful. And two, just the stats. The first time pass rate
Mhm.
on the neurologic clinical specialist exam for someone who's completed a residency is 96%. That makes
Wow.
it feel good. All
Mhm.
the hard work that I put into from a learning standpoint, from the didactic curriculum within my residency, I feel like really paid off. That when I was looking at these test questions that are really complex, rather than freaking out because there were 5 answers that I had no idea what I could narrow it down to 2 or be confident with one. So I feel
Mhm.
like, much like preparing for the boards, I gave myself the best option to attack each question with confidence rather
Mhm.
than sit there like, oh no.
Well, you've talked about a lot of really good things of what's come from the residency that you've completed, um, but talk to me a little bit about maybe some of the reservations that you had, or some cons that someone might think through, the opposite side of all the positives.
Sure. I would say definitely the type of person that a residency attracts is very type A, very driven, and
Mhm.
these people are often prone to overextending themselves. And
Sure.
in a residency, take my program for instance, I was full time in clinic, I was lab assisting in Emory's DPT class, I was lecturing, I was doing research, I was volunteering. So that's
Mhm.
just 5 things off the top of my head that
Mhm.
your schedule, you're putting in some 100+ hour weeks, and
Yeah.
it really can be hard to get that work-life balance, which is what we strive for in life. And I think
Mhm.
that can drive some people insane. I know myself and some of my co-residents really had to take a step back and have some cathartic type sessions where we talked each other
Mhm.
down, and because it can be really stressful, and you're not
Sure.
going to have that stress at your first PT job. You're going
Mhm.
to have a lot more weaning into things, where in the residency, like I said earlier, it's kind of
Mhm.
baptism by fire. So I
Yeah.
think if you're not a quick learner, and if you're not good at taking lots of constructive criticism, it may not be the thing for you. Because at times, I
Mhm.
felt like I wasn't doing anything right.
Sure.
But that ultimately led to successes in my practice. So I would say definitely it's going to be more stressful than anything you've ever done.
Mhm.
For most programs, you make a little bit less than a full-time salaried therapist. So from a
Sure.
financial standpoint, not
Mhm.
to mention that many residency programs, in addition to you getting paid, you have a salary that you have to pay for
Mhm.
certain classes that you take while you're in there. So
Sure.
it can be financially stressful coming out of DPT school. Many people have over $100,000 in debt. So
Mhm.
I think the one word I could use would be stress, that
Sure.
a lot is expected of you and a lot is put on your plate. So it's very easy to get overextended.
Right. Well, that's good. Those are all really good points to bring up. I mean, I personally did not complete a residency, and pursue any sort of certification, so I jumped right into the career market.
Mhm.
But I see both sides of that, where I was able to do that with less stress than maybe you were going through that first year. But here you are now. You've completed this certification, and now you've set yourself apart as someone who can jump into a specialty, and now what you're doing in creating your own neurological. Um, subspecialty within the clinic in Chicago. That's amazing. And so I think a lot of opportunities have come out of it for you. And so that's pretty exciting. For those who are interested in learning more about this program, I think it's really exciting that we've put this together, the residency prep guide. And so at ptprogress.com/residency guide, you can download that guide, or take a little bit closer look at what we've got going on, and some of the coaching available through PT Progress with Cam and myself for interviewing how to ace that. So check it out, ptprogress.com, and we'll be tuning in for a few more videos here to come. Thanks, Cam, for checking in with us, and we'll talk to you soon.
Thanks for having me, Tim. I appreciate it.